This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Wednesday, July 22nd. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. New data released by the U.S. Centers for Disease Control and Prevention says the actual number of coronavirus infections in some parts of the U.S. is anywhere between 2 to 13 times higher than what has been officially reported. The CDC based its conclusions on blood samples collected from people who were given routine clinical tests across 10 geographic regions. On Tuesday, the U.S. posted more than 1,000 coronavirus deaths, the first time since early June the U.S. reached the grim single-day milestone. The U.S. has nearly 4 million coronavirus infections and more than 142,000 fatalities, according to Johns Hopkins University. Meanwhile, the United Nations International Children's Fund says the closing of educational facilities due to the pandemic is resulting in at least 40 million preschool students worldwide missing out on learning and development. Now to Africa, where Zimbabwean President Emmerson Mnangagwa says that security forces on Wednesday will begin enforcing a dusk-to-dawn curfew to tackle the coronavirus outbreak. But critics and the opposition say authorities want to stop anti-government protests by activists who say government corruption has worsened economic hardships. In South Africa, planned blackouts have returned, frustrating citizens who are just regrouping after nearly 4 months COVID-19 lockdown. South Africa is heading towards the peak of its outbreak, now topping 380,000 total infections this week, according to Reuters. The South African International Ballet competition was forced online this year due to the COVID-19 pandemic, but becoming the first international ballet competition to go entirely virtual didn't detract supporters. The competition earlier this month attracted competitors from 30 countries, the largest participation ever for the biannual event. Marisa de Klerk reports from Johannesburg.
The COVID-19 pandemic's cancellation of most events almost crushed South African ballet dancer Sikhumbuzo Dlahleni's dream to compete worldwide. Instead, he became part of ballet history when the South African International Ballet Competition this year leapt into cyberspace. But taking part in a dance competition by recorded video, says Dlahleni, was not easy.
I haven't been on stage for quite some time, and because of this COVID. And I told myself that the only thing I need to do here is to have fun. And for me, it was quite challenging because audience wasn't there, the judges wasn't there. So I felt so lonely.
Africa's premier ballet contest is held every 2 years with age categories ranging from primary school children to adults. But because of safety concerns due to the COVID-19 pandemic, the competition was moved online. The number of participants almost doubled.
People didn't have to fly, so they saved a lot of money in the actual cost of attending.
Contestants recorded one classical and one contemporary performance to upload 2 weeks before the competition. A jury of global dance judges watched the recordings and then uploaded their video reviews. Jury chairperson and director of the Dutch National Ballet, Ted Branson, says he was at first skeptical of an online dance contest, but changed his mind.
It is a format that can actually work and that actually can give more opportunities to people who otherwise would be missing out. So it is a really valuable lesson. It has its pros and cons, but I think for this particular event, it has worked out really, really well.
During the week-long contest, ballet experts also offered online training and panel discussions. South African-born ballet dancer Toriso Magongwa says the virtual initiative is a ballet game changer.
This is a huge platform for possibilities. So I think it's really literally opened the floodgates for possibilities for our students. To keep ballet as part of our lives, we've got to let it evolve.
The South African International Ballet Competition ended with a virtual awards ceremony and an online gala concert. Marise de Klerk for VOA News, Johannesburg.
Oreolua Akinawo is in his element. Lagos bars and restaurants are closed and Nigerians are struggling to socialize. The COVID-19 pandemic is his perfect time to find a soulmate online. Soraya Ali reports.
With Lagos's bars and restaurants shut, some Nigerians are struggling to socialize.
Gender roles.
But for those like Oreolua Akinawo, now is the perfect time to find a soulmate online. He's part of a boom in internet dating, sparked by the lockdown and tailored for Nigerian professionals. In Lagos, pre-outbreak courtship often revolved around social functions, as well as couples meeting through their church or mosque social networks. But Oreolua says this is much more his element.
The dating thing, like during this restriction, it works perfectly for me because I'm really an indoors person. I'm not the type of person that would go out and stay out. Like, I like coming back home. I like my bed. I like my house. I'm safe. I'm comfortable here.
Vibe, an app which went live in April 2019, has seen user numbers grow by almost a third to roughly 8,000. Along with apps like Lagos Matchmaker, they've moved activities online to offer up premium services. For example, at Vibe, game nights and speed dating sessions are all online now. That was how Oreolua met a woman he describes as cool, witty and smart. They speak 4 or 5 nights a week, and he says meeting online has given him a deeper connection.
It removes all those visual stimulants. So like, you're no longer really focused on what the person looks like, but you're focusing on the questions, on the answers to the questions that you're hearing from the person. So it feels more personal than before.
That was Soraya Ali of Reuters reporting. The United States coronavirus cases continue to rise, and amid national polls that show Americans overwhelmingly disapprove of President Donald Trump's handling of the pandemic. Meanwhile, Trump on Tuesday resumed his appearances at COVID-19 press briefings and delivered his strongest endorsement yet on wearing facial coverings. White House correspondent Patsy Widakuswara has our report.
Only 65% of American adults, according to the latest Pew research, say they wear a mask in stores or other public businesses. After months of downplaying the importance of face coverings, earlier this week, President Donald Trump tweeted a photo of himself wearing a mask, calling it patriotic. On Tuesday, Trump resumed the White House coronavirus press briefings and signaled his strongest support for masks so far.
I have the mask right here. I carry it, and I will use it gladly. No problem with it. And I've said that, and I say, if you can, use the mask. When you can, use the mask. If you're close to each other, if you're in a group, I would put it on when I'm in a group.
In April, the U.S. Centers for Disease Control and Prevention reversed their guidance on face masks and said all Americans, not just medical workers, should wear face coverings. But the president has resisted wearing one in public until earlier this month. He has also avoided a national mask mandate, saying that he wants people to have freedom. A recent ABC News Washington Post poll shows that 64% of Americans disapprove of Trump's handling of the pandemic.
That it's creating even more problems for him as the pandemic flares, including now in areas where Republican governors have taken his cues, opened things up, and now they're starting to see terrible problems with the pandemic, and that makes his job much harder.
The U.S. has more than 140,000 COVID-19 related deaths and more than 3.8 million coronavirus cases, with new data from the CDC suggesting the actual number may be 10 times higher. While the administration insists the number of cases has risen due to an increase in testing, Experts say the lack of a national policy on the coronavirus is the reason the country is doing so poorly.
The countries that have done well have had a clear national policy. They've put the public health people out front. The political leadership has assisted the public health people, and they have had consistent, clear messages to the population. The population understands what the program is, and they're enlisted to cooperate. That's a formula for success. By leaving it to the governors, that's a formula for chaos.
Despite the rise in cases, Americans continue to flock to summer vacation spots like beaches. Different states have different rules, and the federal government's recommendations on masks, testing, and reopening the economy have all been voluntary. Patsy Widakuswara, VOA News.
Due to a rise in COVID-19 cases, Los Angeles Mayor Eric Garcetti announced that he is considering another strict lockdown just a few weeks after the metropolis started to ease restrictions. One problem is that COVID-19 is rapidly spreading in state prisons. The issue is so worrying that the state is considering releasing about 8,000 prisoners convicted of minor offenses. VOA's Angelina Bagdasariani reports and Anna Rice narrates.
California continues to be one of the coronavirus hotbeds with around 400,000 confirmed cases. The situation is particularly grim inside state prisons. To ease the problem, officials say they're looking at releasing 8,000 prisoners convicted of minor offenses with fewer than 180 days left on to serve. Those over 30 who have health problems will be freed first. About 3,000 California inmates have already tested positive for COVID-19. At least 10 people have died. Critics say inmate transfers prompted the rapid spread of the virus in prisons. Since then, state has replaced its top medical examiner for prisons. Former inmates share their experience in prison during the pandemic.
Scary, dangerous, uncomfortable, unpredictable.
The inmates' relatives and close ones are organizing protests near prison walls.
They're dying in there. They're dying. Free them all. Free my baby.
Human rights activists say the situation at the San Quentin prison is no surprise.
San Quentin is a very old, antiquated prison. It has a single ventilation system that recirculates air, so it's not a surprise to any of us. Prisons are not meant to be social distance areas.
Vanessa Nelson Sloan is co-founder and director of an organization that helps inmates.
I think, in my considered opinion, would help the most. That is, get every single staff member to wear the masks that they have been provided. Prisoners are required to wear masks. The prisoners can be given a disciplinary violation if they don't. The guards are another situation. That, I think, would be the most important thing we could do in all the prisons right now.
The decision to release prisoners is welcomed at the Life Support Alliance, but many here worry that many ex-inmates will have nowhere to go. And since the state's homeless shelters are packed, that makes them risky places to be as well during the pandemic. For Angelina Bagdasarian in Los Angeles, California, Anna Rice, VOA News.
As India's COVID-19 cases near the 1 million mark, cities like New Delhi, home to over 20 million people, are ramping up their health infrastructure to cope with the pandemic. Experts say the coronavirus pandemic has turned the spotlight on India's grossly inadequate healthcare system, even its biggest cities. And Jana Pasricha in New Delhi has our report.
Suhasini Sood made frantic calls to hospitals when her parents were infected with COVID-19 last month in case their condition deteriorated.
You read in the news that, people had gone to hospitals and hospitals had refused patients, and that they'd said that no beds were available. So that was a big fear. We'd also called up a few hospitals to check whether they would take the patients in, and some of them had flat out refused.
To plug the shortfall of hospital beds, cities like Delhi have set up huge temporary COVID care centers. This 10,000 bed facility, fitted with cardboard beds and operated by the paramilitary, opened recently in a religious center. It is one of the world's largest. Delhi's race to convert train coaches, hotels and even marriage halls into care centres was inevitable. India's spending on public health is abysmally low.
About 2.5 beds per 1,000 population has been generally the norm, whereas in India it's been about 0.7 beds per 1,000 population.
Struggling healthcare facilities as the virus rampages through densely packed cities have prompted new lockdowns in some places, like the information technology hub of Bengaluru. But in Delhi, there is a ray of hope.
The number of people who are turning out to be new corona cases is on the rise, but at the same time, the number of people requiring critical care, ICU care, ventilatory care is on the decline. And today, most of the COVID caring hospitals in Delhi have beds vacant for such patients.
That is because 3 months into the pandemic, doctors have a better handle on treating the virus. Sood's parents, for example, recovered at home.
It's only later on that reassurance came that only 15% or so may require hospitalization and only 5% may require intensive care.
However, the pandemic highlighted the huge gap in facilities between India's expensive private hospitals and public ones. Middle and upper class Indians like Sood rule out being treated at a government centre.
That was never an option. I think the perception of a public hospital is that basic hygiene standards might not be met, and fear that he'll probably be uncomfortable and contract other illnesses. So yeah, that was never something we considered.
Whether India overhauls its public health facilities remains to be seen. For the time being, the world's third worst affected country faces a long and hard battle as cases race toward the 1 million mark. Anjana Pasricha for VOA News, New Delhi.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Coming up, youth in one Nigerian state gets incentives to embrace agriculture. We'll be right back.
Hello, I'm Linor Moudou, your VOA Health correspondent. During the COVID-19 pandemic, the World Health Organization says the best way to reduce your chances of being infected or spreading coronavirus is to wear a mask to avoid breathing any small liquid droplets which may contain the virus. Regularly wash your hands with soap and water or clean your hands with an alcohol-based hand sanitizer. For more information on COVID-19, visit who.int or contact your local or national health authorities.
Welcome back to Africa 54. Youth in Yobe State's northeast Nigeria are being encouraged to embrace agriculture and harness the state's opportunities. The state government is providing free fertilizer to 1,000 hectares of land cultivated by youth in the state for this year's farming season. Governor Maimala Buni promises more support for as many that will seize the opportunity being made available under the state's youth empowerment program. We learn more in this report from Channels TV in Nigeria.
Yobe State, northeast Nigeria, is a predominantly agrarian state with the potential to produce various food crops in large quantity. But poor knowledge of modern agricultural practices, in addition to security threats, including Boko Haram insurgency, limits farmers' production capacity and output. To help farmers move from subsistence agriculture to commercial farming, the state government is offering fertilizers at a subsidized rate and distributing tractors to support farmers, particularly the youth in the field.
To further accelerate assurance of our goals in agriculture, we have given a boost to the Youth Farm Empowerment Program. Already 1,000 hectares of land have been harrowed and planted, while fertilizer will be provided free of charge to all participating youth farmers.
Farmers across the 17 local government councils of the state will benefit from the sale of 7,500 metric tons of fertilizer, fortified seeds, and distribution of tractors. The aim is to boost food sufficiency while encouraging youth to embrace agriculture.
We thank the governor for revitalizing the agricultural sector. The 1,000 hectares of land was abandoned years ago, but now it has been revived for youth to farm food produce.
Agriculture has been described as the largest employer of labor and income-generating activity in Nigeria. And Yobe State, like any other state, is keen to take advantage of the boundless opportunities and do all it can to lure the necessary manpower to the sector.
In the digital age, you can take acting lessons from Samuel L. Jackson or enjoy basketball legend Kareem Abdul-Jabbar personally wishing you a happy birthday. Online forms like Cameo and Masterclass are democratizing access to celebrities by turning the famous into gig economy workers. VOA's Tina Trin reports.
So here we go. Happy birthday to you.
Deborah Cox is a multi-platinum Grammy-nominated R&B artist and Broadway star.
Happy birthday, dear Teo.
So the fact that she personally sang happy birthday to one of her biggest fans was pretty remarkable.
She was singing happy birthday to me, so it was great. It was pretty cool.
It was very personal, which I think was just amazing.
These days, getting access to a superstar doesn't require calling in multiple favors or knowing the right people. Internet sites like Cameo are giving everyday people a backstage pass.
We're like the person lifting up the red velvet rope and letting people in.
Stephen Galanis is the co-founder of Cameo, an online marketplace where users can commission various celebrities, musicians, and athletes to create personalized video greetings.
You put the message in that you want them to say to whoever you want them to say it to. The talent has 7 days to return a video. Our big idea here was that the selfie is the new autograph. So imagine this is kind of the autograph for 2020.
The company recently celebrated its 1 millionth cameo. It takes a 25% cut for each celebrity gig. Comedian Gilbert Gottfried has done over 1,200 videos at $150 each.
With the pandemic, well, obviously all nightclubs have closed down. Movies, TV, everything is pretty much closed down. So yeah, this has definitely been a good replacement.
It's not only a chance to earn extra income. Cameo allows Gottfried to remain connected with fans.
They're excited about the fact that you're talking to them personally.
Masterclass is another firm giving ordinary people access to celebs. Users pay an annual $180 subscription fee for video classes in a variety of subjects, taught by some very familiar faces.
Every time a camera passes you when you're on set, always look like it's something on your mind.
Whether it's acting lessons from Samuel L. Jackson or drumming lessons from Sheila E., spotting a celebrity is no longer just for the lucky.
Years ago, you'd hear that your friend had a friend who had a friend who had a cousin who had a dentist who had another friend who saw a celebrity walking down the street. Even then, it was an amazing story, and you couldn't believe that celebrities exist in real life.
Not only do they exist, but they might make you feel, at least for a little while, that you're a part of their world. Tina Trin, VOA News, New York.
In our tech report, if you have ever dreamed of having a digital clone do your work, a San Francisco technology firm may be able to help. The AI Foundation's mission is to help us each create our own digital replica. Matt Dibble reports.
Hello, I'm a digital version of Dr. Deepak Chopra. Soon, I can go with you everywhere you go. I'll be inside your phone, ready at any time to serve you.
Deepak Chopra, the alternative health guru, reaches millions with his books and television appearances. But you can't exactly call up the doctor when you need him. Introducing Digital Deepak, an artificially intelligent tool like Siri or Alexa, but with more personality. It has been trained by the real Deepak Chopra to converse and give guidance, much like he would. Built by the AI Foundation, Digital Deepak is a pioneer in what the company hopes will become a busy AI world.
Our mission is to build a better world by giving each of us our own AI that works exclusively for us.
You heard that right. A digital twin for all 7 billion of us.
We're not looking to replace people with AI. We're looking to give them an extension that can take their purpose, their mission, their ideas, their memories forward in time and out into the world in a bigger way. Your AI can go into the world and discover things or discover people that you don't have time or access to and bring these back to you.
At a youth summit, the company demonstrated personal AIs made with conference delegates, having conversations and learning from each other.
My name is Kumhyuk Kim. I am North Korean, and I'm determined to help spread democracy in my country.
It would be a shame if just a few people in the world ended up with the most powerful AI. That's the path we might be on right now in the world, and we're really looking to correct that.
Step aside social media. Personal AI is coming. What will you do with yours? For VOA News, Matt Dibble, San Francisco.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thank you for watching.